Right now, countless older adults around the world are taking medications that seem completely harmless on the surface. These are not experimental drugs. They are not banned substances. They are pills approved by health authorities, prescribed in clinics every single day, and stored in bathroom cabinets without a second thought. But behind the scenes, something alarming is happening. Cardiologists and heart surgeons are beginning to notice a disturbing pattern. Patients arrive in operating rooms with heart damage that doesn't match their age or lifestyle. Arteries are more inflamed than expected. Heart muscles appear weaker. Electrical rhythm issues are showing up without any clear explanation. When doctors start digging through medical histories, the same types of medications keep appearing again and again. What doctors have been seeing firsthand for years is now being confirmed by large-scale medical research. Multiple international studies are showing that certain commonly used drugs can significantly increase the risk of heart attacks, dangerous heart rhythms, heart failure, and even sudden cardiac death, especially in older adults. These are not rare side effects. In some cases, the risk increases by 30, 40, or even 60%. And most patients taking these medications are never warned about the potential impact on their heart. Today, we're going to break down the full picture, starting with medications that pose moderate risk, and working our way toward the one drug class that heart specialists now find the most concerning. Before we begin, let us know in the comments your age and where you're watching from. We read every comment. Let's get started. Number 7. Acid-reducing medications. Drugs used for chronic acid reflux are among the most frequently prescribed medications worldwide. They are very effective in the short term. The problem begins when they are taken daily for years. Long-term use has been linked to reduced blood vessel function, higher inflammation, and increased risk of heart attack. Researchers believe these drugs interfere with nitric oxide, a compound that helps blood vessels stay relaxed and healthy. When nitric oxide levels drop, arteries stiffen, blood pressure rises, and clot risk increases. For many people, lifestyle changes, such as weight loss, meal timing, and sleep positioning, can reduce acid reflux without long-term medication use. Number 6. Certain antibiotics. Some powerful antibiotics are extremely effective, but they can also weaken the structure of major blood vessels and disrupt the heart's electrical system. Studies have shown increased risks of dangerous rhythm disturbances and even tears in the body's main arteries shortly after using certain antibiotic classes. Because of this, health agencies now recommend these drugs only when absolutely necessary, especially for older adults. Number 5. Common pain relievers. Non-prescription pain medications are often viewed as safe because they're easy to access. But regular use, especially at higher doses, can quietly increase blood pressure, promote clot formation, and strain the heart. Research shows that cardiovascular risk can rise within days of starting frequent use. For chronic pain, safer strategies often include physical therapy, topical treatments, and non-drug approaches. Number 4. Older diabetes medications. Some older diabetes drugs lower blood sugar effectively but do little to protect the heart, and may even increase cardiovascular risk. Newer diabetes treatments have shown the opposite effect, reducing heart failure and cardiac death. That's why medication choice matters. Managing diabetes isn't just about blood sugar, it's about protecting the heart. Number 3. Sleep medications. Sleep problems are common with aging, but certain prescription sleep aids come with serious risks. These drugs can worsen breathing during sleep, aggravate undiagnosed sleep apnea, and increase the likelihood of falls and heart events. Long-term studies have linked frequent use to higher rates of cardiovascular death. Non-drug approaches like sleep therapy and routine adjustments are often safer and more effective over time. Number 2. Antipsychotic medications. These medications are sometimes used in older adults for agitation or behavioral symptoms. However, they have been strongly linked to sudden cardiac death, dangerous rhythm changes, and blood pressure instability. Because of these risks, medical guidelines urge extreme caution and recommend non-drug approaches whenever possible. Number 1. Prescription opioid pain medications. According to many heart specialists, this is the most dangerous category for older adults. Long-term opioid use has been associated with dramatically higher rates of cardiovascular death. These drugs suppress breathing, lower oxygen levels, disrupt heart rhythm regulation, and increase inflammation throughout the body. Over time, opioids can weaken heart function and reduce the heart's ability to adapt to stress. When combined with other medications, such as sleep aids or anxiety drugs, the danger multiplies. The encouraging news is that pain management has evolved. Many patients successfully reduce or eliminate opioid use through guided tapering, physical therapy, targeted procedures, and alternative pain strategies, often with improved quality of life. The message from heart specialists is not fear, it's awareness. Medications that once seemed harmless may carry risks that were not fully understood when they were first prescribed. Science evolves. Evidence grows. And patients deserve clear information so they can make informed choices. Heart damage linked to medications is often preventable, but only if people know the risks and feel comfortable discussing them with their doctors. So here's the question for you. After hearing this, would you feel confident starting a conversation with your doctor about your medications? Or does that conversation feel uncomfortable? Share your thoughts and experiences in the comments. Your story may help someone else. Thanks for watching.